Perhaps you've heard it before that the skin is actually the largest organ of the human body. Skin plays a very important role in our residents' health and well-being. What you do each and every day when caring for our residents' skin can have a big impact on the quality of their life.
Our resident skin performs several important functions. It helps to protect their muscles, bones, and organs from infection and injury. It helps to regulate body temperature and hydration, and it's also important for sensation.
When we look at caring for our residents' skin, we want to think about what sometimes happens during the aging process. Skin will thin as it ages. Also, we may notice that residents suffer with dry skin.
Other age-related skin changes can include changes in appearance. Skin can become paler, more translucent, and you may see the development of age spots in sun-exposed areas. Skin becomes less elastic and more fragile, leaving the older adult more prone to bruising. The subcutaneous fat layer thins as we age. This increases the risk of skin injury.
One of the most important things that you can do for our residents each and every day is to keep their skin clean.
It's especially important to keep the resident's skin clean and dry after an episode of incontinence. If the resident has been incontinent of bowel or bladder, change the brief right away and clean their skin appropriately. After a bath or shower, be sure you gently pat the skin dry to avoid irritating the skin.
We also want to keep the resident's skin moisturized. Residents, you will note, have their favorite products that they like to use, so always consult the resident's service plan when bathing and caring for the resident's skin.
Nutrition and hydration are also very important to maintain skin health.
Nutrition plays a very important part. Making sure that the resident is consuming enough protein, getting all their vitamins and minerals through a good, healthy diet, plays an important role in helping them maintain healthy skin. Hydration is key. This is where when you offer a resident beverages in between mealtime, you're actually helping them to have healthy skin as well.
Protect the resident's skin from exposure to sun or other elements when outdoors. Use appropriate sunscreen, hats, or clothing to shield their skin from exposure. One of the most important things you can do for your resident's skin health is to monitor and report any changes.
So often, when we can intervene early for a skin problem, when it's just a little tiny spot, we can have a terrific outcome.
When providing routine resident care, such as bathing or assistance with dressing, check their skin. Watch for redness, rashes or irritation, skin tears, or any signs of pressure ulcers or other skin breakdown. If you ever see a concern, report it to your supervisor right away. It is especially important to monitor residents with mobility issues. Laying or sitting in one position for long periods of time decreases blood flow to the skin and increases the likelihood of pressure ulcers.
So besides keeping our residents' skin clean and dry and well moisturized, we'll want to make sure they're repositioned frequently. Now, some residents will only need a reminder. Hey Charlie, let's go ahead and move this way in your chair now, or let's sit back this way. Or Mary, let's turn on your side in the bed now so you're more comfortable. Other residents, you will actually have to help reposition them with the use of pillows, etc.
So that's it. During this video, you've learned about how important our residents' skin is to their health and well-being, but that it also changes as we age. You've learned some important tips on skincare and things you should look out for when monitoring your resident's skin.